afternoon, Doctor. My name is EshikaParuchuri, and I'm a sophomore at Woodbridge Academy. I appreciate you joining me in this initiative. My primary goal is to educate adolescents globally, empowering them to build healthier lifestyles by collaborating with experienced doctors across various specializations. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Rada Shakov, who specializes in gastroenterology and has extensive experience in dealing with things like colonoscopy and conditions like acid reflux and stomach inflammation, to name a few. And for this episode, we'll be discussing the various aspects of gastroenterology that will help teens maintain good gut health and a healthy lifestyle. And now, Dr. Shakov, can you give us a little background regarding your experience in this field?
Yes. Hi, good afternoon, everyone. My specialty is gastroenterology, which does specialize basically from the mouth on down and does encompass many disorders that can be ranging from belly aches to constipation to diarrhea to acid reflux, as you mentioned, just to name a few. Gastroenterology also does encompass some liver diseases, but there are designated specialists for liver called hepatologists, and I don't generally do a lot of liver disease. My training, my medical residency and internship was done in Patterson at St. Joseph's University Medical Center. It was at the time under the Mount Sinai umbrella, and it's currently under the Seton Hall umbrella. And then I did my specialty training, 3 years of fellowship through St. Joe's in Patterson and St. Mike's in Newark. And they are affiliated with, at that time, it was Seton Hall, not sure where it is now. So I've got about 6 years of specialty training. And I got to see a lot of various medical issues, a lot of different patients, a lot of ages and, cultural background. So it was a quite extensive training during that time.
Okay. Let's get started. What is the gut, and why is it important to maintain good gut health?
So when we talk about the gut, it's not really just the stomach. You think of, yes, it's the stomach, but it's also, you're thinking what is attached to the stomach. That's the esophagus, that's the food pipe. Then you have your intestines, and we have the small intestine and the large intestine, and then you have the rectum. So that really is all of the gut, and it depends on how sensitive one's gut is, and it's really interrelated. When I talk about gut sensitivity, I really mean how we are emotionally, physically, spiritually, mentally stressed out. That can affect the gut. So you may have heard of irritable bowel syndrome, and that can be associated with a little bit of higher anxiety or stress, a range of emotions or situational kind of issues, and that can affect our intestines. Some people can have diarrhea, some people can have constipation, people can have food sensitivities that are not necessarily allergies. So everything, not just the foods we eat, affect our gut. It's our environment, it's our own kind of body's reaction to things. And then, of course, you add processed foods, fatty foods, and people react to those things a little bit differently.
Okay. What causes digestive problems in teenagers?
I think teenagers are more stressed out now than maybe when I was a teenager. You guys, we're all overstimulated. We have our phones, we have our Chromebooks, social media, and quite a number of pressures. And I think that digestive problems can stem from irritable bowel syndrome, just the stress, the anxiety, the kind of pressure to perform, do well in school, academically, and sports-wise, comparing yourself to what you see on social media. So I think there's quite a number of stressors. Plus, it's also dietary related. Sometimes young people are eating more fast food because they don't have time to sit down because they're going from one place or another, or just because you're hanging out and you go get fast food or whatever the case may be. So I think that it's kind of a multifactorial thing that I'm seeing in young people causing digestive issues.
That's very interesting. I mean, when I think of digestive system problems, I usually think of just the diet. I didn't know there were a lot of factors.
Absolutely.
What are some acute and chronic GI conditions that you have seen?
So anything acute can be having acid reflux, and that can be something that's genetic. It can be something that you get via a bacteria called Helicobacter pylori. That can be, turning into a chronic disease too if you don't get treatment for it. And then chronic diseases can be something as simple as somebody who is constipated, but that's just how their digestive system is, that they don't go to the bathroom necessarily every day or even every other day. So that can happen. You can have acute things like diarrhea that can come from infections or a virus, and that can happen from food or travel or sick contacts. So those are things that could happen acutely. Also, people develop ulcers, and that's from taking certain medications too frequently that can erode the stomach and cause an ulcer. And that can be a real big problem. That can cause pain, that can cause vomiting, even serious enough vomiting with blood. So those are things that, we certainly don't want to see in young people.
You mentioned that some conditions can be genetic. So can some skip generations or how does it work?
So when I talk about genetic diseases, I kind of am putting them under an autoimmune category. So autoimmune essentially means your body doesn't recognize itself as self. And some autoimmune conditions that we see in gastroenterology are celiac disease, Crohn's disease, or ulcerative colitis. Now, when one family member has it, it doesn't necessarily mean that the other family member will have the exact same one. They can have a variant, they can have another autoimmune disease. So that's something that we can see in people when they do have, let's say, for example, rheumatoid arthritis. That's an autoimmune disease. Then their kids might have another autoimmune disease, not necessarily rheumatoid arthritis.
Interesting. What specific tests or procedures are needed for diagnosis usually?
So the major procedures that are pretty common in gastroenterology is an endoscopy, or for short, an EGD. That's a tube with a camera that goes through the mouth, through the esophagus, into the stomach, and into part of the small intestine. And that's usually done when a patient is asleep because it's very uncomfortable. There's a lot of gagging that can occur. And that procedure is usually under 10 minutes. And we take biopsies or little samples of the areas that we're concerned with. And then we can see under a microscope, a pathologist will tell us what we're looking for, if it's there or not. And then there's a colonoscopy, and that's literally from the other end, going through the large intestine, and you can even get a small peek in the small intestine at the terminal ileum. And that's a procedure that's usually done also when the patient is asleep. And that helps us look for any abnormalities of the large intestine, whether it's inflamed, whether or not there's polyps or small growths there that can become cancerous, if there's an issue with bleeding, if there's hemorrhoids. So things as such. Those are the major procedures. There are more specialized procedures, something called a capsule endoscopy, and it's pretty much what it sounds like. You swallow a capsule, and it's got a camera inside there, and that's going to travel through the small intestine and give us a better view of that. And you kind of wear it on as like a little fanny pack, and then it just kind of passes through, and you don't ever need to bring that back. And that gives us another view. Then there's other tests, again, much more specialized, something called manometry, and that gives us a look at the esophageal pressures. There's pH testing to see the acid reflux, if it's real or not. Some people may have acid reflux. Some people have non-acid reflux that feels like acid reflux. So there's a whole bunch of procedures. There's more complicated, like an ERCP. So it's an endoscopic retrograde cholangiopancreatography. It can look in the biliary system. There's endoscopic ultrasounds. Those are more advanced, and oftentimes doctors get more training for those specialized procedures.
I see. So, is the major difference between an endoscopy and a colonoscopy just where you're entering?
Well, the major difference is, yes, where you're entering and what you're able to look at. So the endoscopy, we're going to look at the upper gastrointestinal system, the esophagus, the stomach, parts of the small intestine, and the colonoscopy is generally the large intestine and the rectum. So oftentimes we're doing that as a screening tool to look for polyps, which can be precancerous growths or that can, become a colon cancer or a colorectal cancer. So that's what we generally do in that kind of sense.
Okay. Are there any particular foods or substances that should be avoided?
Well, I tell people avoid what bothers you. So if eating red sauce on pasta or having a pizza is bothering you because it's causing acid reflux, don't eat it. Chocolate can cause acid reflux, so if that's bothering you, don't eat it. If milk causes diarrhea, you may be lactose intolerant. Don't have it. I don't necessarily tell people to avoid all types of food because not all types of food bother people. Some people have sensitivities to food, and I say just avoid what bothers you.
Okay. What dietary or lifestyle changes do you recommend for teenagers to manage or improve their condition?
Well, I think it's really important to eat healthy as possible. And what that means, of course, some fruits and vegetables. Try to limit fast food. Try to limit fried things. Try to get as much protein as possible. Avoid sugary drinks like juices or sodas. Try to get as much water as you can, at least 64 ounces a day, particularly if you move around and exercise. I'm a big advocate of exercise and working out and getting your body moving. So I think that's important to create these habits now while you're young, because it's much easier to do it now rather than when you're older and try to start to get fit and eat right.
Yeah. What symptoms should prompt us to seek immediate medical attention for GI issues?
Well, if you ever vomit blood or see blood in your toilet bowl, that you should immediately tell your parents and get to a doctor. If you have severe belly pain, absolutely that warrants immediate attention. If you're noticing a decreased appetite or you're getting full faster, that's definitely important to be aware of. Or unexplained weight loss. You definitely want to make sure that you tell a physician, your parents, about that to get that looked at.
Okay. Can puberty cause gastrointestinal problems?
Well, puberty can cause a lot of issues. Certainly with the changes in hormones, it can affect your digestive system. It can affect what you're sensitive to. It can, bring about potentially irritable bowel syndrome just because the changes in your body are, causing everything to kind of wreak havoc. So it's possible, but it's not necessarily 100% guaranteed.
Okay. Is gluten-free or grain-free diet best for health?
No, because if you're not sensitive to gluten, why avoid it? I do believe that we eat a lot of processed food, whether it's because we're busy or because it's hard to get to the store for fresh food every single day. I do believe people are more sensitive to not necessarily gluten, but maybe the way that things are packaged or preserved. I don't think being gluten-free is a healthier option. I think that making sure you have whole grains, avoiding eating too much carbs, making sure you are getting protein and fruits and vegetables is the best way to eat.
Okay. What are functional GI disorders? Do they impact teens?
So functional GI disorders can impact anyone that has them. So it can be anything from Crohn's disease, ulcerative colitis, celiac diseases. Pretty much any of these can impact teens. We do see young people presenting with these issues. I've noticed young people have a lot of irritable bowel issues where they get maybe anxious before a test or whatnot, and may feel nauseous or may have diarrhea. So a lot of these disorders can impact teens, and I think because we're more aware that these things can happen, and teens are kind of more aware of their surroundings and their own bodies and can get answers with Google, which I don't recommend. But I think that they can, figure out that there's something maybe not right going on in their body and get answers.
Okay. Can you tell us about an interesting case that you've had before that might have struck out to you or seemed very intriguing?
Certainly. I mean, I've seen a lot of interesting cases. I've seen patients come in who kind of look pretty healthy and they're just not feeling good. And then all of a sudden you see their liver numbers are completely out of whack. And, it's a mystery. You have to figure out what's going on. Or I've seen patients with horrible diverticulosis, which is essentially somebody who is chronically constipated or has a lot of constipation, and their stool presses on the colon and creates these little outpouchings, and it kind of almost looks like a bee's like nest where you see all these openings going through, and it can make performing a colonoscopy pretty scary. But yeah, I've seen quite a number of unusual things, and I've seen a lot of sad things, which I'd rather not talk about on this podcast because it's the effects of alcohol on the liver can lead to really detrimental outcomes. So those are kind of the things that always stick out with me and that I kind of remember more than anything.
Can GI symptoms in teenagers persist into adulthood?
Yes, of course. So something like irritable bowel can be with you for your entire life. And if you're aware of it, you can manage it. Certainly acid reflux can persist into adulthood and you have to stay on proper medications for it. People with chronic constipation may have that into adulthood. People with celiac disease will have that into adulthood. So yeah, there are a number of GI diseases that, once diagnosed in the young years can and will persist.
Hey, what are the ways to relieve stress-related teenage stomach pain?
Well, get rid of the stress, or at least figure out a way to manage it. Certainly for young people who have a lot of schoolwork, I can't do anything about the schoolwork, but you can recognize when you're getting stressed and kind of try to work in breaks. Try to do things that you love, whether it's sports or music or art. Try to be aware of something that is causing you that stress. Talk to your parents about it. That's another thing is holding everything inside is certainly not going to help. Kind of step away from social media and the phone to get a break from that. Those are kind of the best things that I could recommend.
What types of digestive conditions often affect children?
So children, certainly you can see celiac disease, you can see Crohn's, ulcerative colitis. There can be some genetic liver diseases. There's really anything can affect young people. Lactose intolerance can be seen in children as well. So it's not uncommon.
I've seen that you've mentioned celiac disease. Can you explain what it is exactly?
So celiac disease is essentially a gluten intolerance, where if any person has any amount of gluten that can be found in wheat, rye, barley, anything like that, they can get severe stomach pains, they can get diarrhea, they can get just pretty much that feeling of being bloated, uncomfortable, and they cannot tolerate it, they cannot process it, they cannot digest it.
Okay. Can exercise or physical activity cause abdominal pain?
It shouldn't. If you're exercising and you're not in shape, certainly you can feel discomfort because blood flow is going away from the organs and to your muscles. So that can happen. But if you're feeling abdominal pain during working out or physical activity, then you should let your parents know and see a doctor about that, because it shouldn't happen.
Okay. And have you seen a gender bias in any GI conditions?
From my experience, not necessarily. I feel that, if somebody is presenting with legitimate complaints, for me personally, I'm going to treat the complaint regardless of who it's coming from.
Mhm. What is food poisoning and what causes this issue?
So food poisoning is something that occurs either maybe the food is spoiled, or there is a bacteria, or you're eating the food raw, which can have a bacteria or a virus that essentially your body cannot tolerate. And so it can be mild from a bellyache to severe, leading to dehydration, diarrhea, vomiting, fevers requiring hospitalization. So it just depends on the particular food, how it is cooked. If there's, most of the time it could be from eating raw or undercooked food. So a lot of people know chicken and salmonella, but there can also be pork. There can also be from reheated rice, oysters, deli meats if you're pregnant. So there's a number of things that can cause the food poisoning, and it can span from bacteria, viruses, due to raw or undercooked food, or just food that's gone bad.
So I see there's so many factors that play into food poisoning, but what can we do to prevent it?
Well, just be aware, certain foods you shouldn't eat raw, like chicken, pork. You want to make sure those are cooked. Make sure that you smell your food. I know that sounds kind of crazy, but you want to make sure your food hasn't gone bad, your milk hasn't gone bad. Just to make sure, there are some things like, people that eat raw oysters, myself included, we're kind of, playing a little bit of Russian roulette because you can get poisoning from that. So just be aware of what you're eating and where you're eating, because servers who don't wash their hands can also cause food poisoning.
Okay. Did COVID-19 have an impact on gastroenterology clinics or the way that patient care was served?
That time period, I think that because things were very different, I'm not sure. I don't work in a large hospital setting. I think that for the time period, for that 2-3 months where things were on lockdown, I think that all healthcare changed because to be seen, it needed to be an emergency. I think it changed healthcare because you were now seeing your doctor via Zoom. You were doing telemed. It's kind of hard to touch someone's belly via Zoom. So I think that changed. It's hard to do a physical exam when you can't actually touch a patient. So I think that changed healthcare dramatically, yes.
Interesting. And what changes have you seen from when you first started this specialty to now?
I think the medicines have come such a dramatic long way. When I first started training, it was in 2007 for my GI fellowship, and there was no cure for hepatitis C. Basically, you did a year of treatment and fingers crossed. And I can tell you now, it's really changed. Hepatitis C is a virus that affects the liver, and now you can have complete, remission and cure within 12 weeks, within, a fraction of the time. So I think that medicine has changed for the better in providing people opportunities for cures.
It's very nice to see that it's very evolving.
Absolutely. Absolutely.
Okay, so now we will move on to our second segment, which consists of common myths about gastroenterology. If you don't have bowel movement every day, something is wrong.
That is a myth because everybody's body is different. And so if you're not going to the bathroom every day, that's quite all right, because maybe your body doesn't need to go every single day.
Okay. Don't swim at least a half hour before eating.
I don't know. I let my kids swim with about 10 minutes. It's all about blood flow. So if you've just eaten, your blood is going to your stomach, so it doesn't go to your muscles. So if you get a cramp or something like that, I'm going to go maybe potentially myth.
Okay. Ulcers are caused by spicy foods.
That's a myth. Ulcers are caused by Helicobacter pylori. Ulcers can also be caused by certain medications, essentially acting as an irritant on your gastric lining.
Aging causes constipation.
That's semi, because as we age, sometimes people need medications for certain illnesses, and some medications can cause constipation. Aging in and of itself shouldn't cause constipation, but you have to remember you want to drink as much water as you can. Make sure you eat fiber. Yes, our body does slow down, but in and of itself, aging shouldn't really cause constipation.
Beans cause the most gas.
I don't know about the most, but they do cause gas. Broccoli causes gas. Cauliflower can cause gas. But, beans can certainly cause gas.
No dairy for lactose intolerant.
Kind of, sort of. You can have lactose-free dairy, or you can take a lactate pill. and still consume dairy to, kind of counteract those symptoms.
So when someone says that they're lactose intolerant, is it because milk cannot be digested, or do they have some kind of immune system like reaction to milk?
Essentially, it's because they don't have the enzyme to absorb the lactose in milk, ice cream, cheeses. But it also can be a different kind of spectrum of lactose intolerant. It can be a slight bellyache, it can be some gas, it can be some nausea, it can be outright diarrhea. I think sometimes people confuse lactose intolerance and just kind of, I can't really have it. It just doesn't feel great. You know what I mean?
That makes sense. If your stomach rumbles, it means you're hungry.
Probably. Or that you're digesting food.
Okay. So we have finished the myth segment, and we will now move on to our final segment consisting of our 2 final questions.
Okay.
Let's start with a scenario. Let's say that an individual notices that they are frequently experiencing abdominal pain and bloating after meals. However, they decide to ignore these symptoms. Why can ignoring symptoms like this create a larger impact in the future?
Well, it just depends what their underlying issue is. So if they have maybe, let's say, Helicobacter pylori, that can cause an ulcer, which can cause bleeding, which can even perforate or rupture. Continued, abdominal pain or bloating or discomfort is not going to feel good after a long time. You're not going to be able to ignore it. You won't be able to eat. You might lose weight. So something like that is going to eventually come to the point where the issue becomes an emergency.
Okay. What is your take on Google Doctors?
On what?
Google Doctors. Searching links on the internet to find answers.
My patients are well aware one of my caveats is do not look for answers on the internet. When you Google things, you will find the worst case scenario. You will see things that will terrify you. You will have people giving advice that is the worst advice you could ever get. It's better to seek the advice of a professional, somebody who's gone to medical school, somebody who has experienced this, that can tell you, your particular symptoms, that can explore what is going on with you and give you personalized advice, not just kind of the worst case scenario advice.
Okay. And with that, our podcast session has now concluded. I want to express my gratitude for your time, insights, and contributions. And for our listeners,
nourish your habits to flourish your lifestyle.
Thank you. And don't forget to follow us on our website, healthyteens.net. Stay tuned until the next episode. Take care.